Good morning, good afternoon, good evening, colleagues, and welcome to this seminar on obesity, advancing the global food and health agendas, co-organized by World Obesity with WHO and Unicef. As you well know, 2021 is the year of the UN Food System Summit. It's unprecedented that such a broad, comprehensive discussion is convened with such a large involvement of many constituencies. We are having this week a week-long food system dialogues, health talks from the 3rd to the 10th of June 2021 to particularly highlight the health component of food systems. We believe there are at least 5 pathways of interaction between food systems and health. First and foremost, unsafe animal practices affect the way that we transmit diseases with global zoonosis, pathogens, and antimicrobial resistance. Second, inadequate agricultural practices can lead to pollution of soil, air, and water. Third, growing, harvesting, and transforming food exposes food workers to occupational hazards and may have an impact on their physical and mental health. Then unsafe and adulterated food, including the ingestion of foods containing pathogens, chemical, and toxical, lead to several forms of foodborne disease. And fifth, unhealthy diets and food insecurity have impact on multiple forms of malnutrition and diet-related non-communicable diseases. So the meeting of today will explore some of the challenges in multi-sectoral approaches that must be overcome to address obesity, as well as highlight the resource gap in the obesity response. It's meant to explore the opportunities provided by the UN Food System Summit to advance global action on obesity, to introduce a new initiative that WHO, World Obesity, and Unicef have put together, the idea of creating a global obesity coalition and having a series of work streams to intervene on the early causes of obesity from really early in life, but also to address how to manage the conditions which is so common all over the world. You're familiar with the rules of the webinars. Please make questions, comments, reflections in the chat box, ask questions in the Q&A box, and we'll be pleased to respond. And with this now, it is my pleasure to introduce Joanna Ralston from World Obesity. Joanna, over to you.
Thank you so much, Francesco. Thank you for that introduction. It is my great pleasure, actually, my understanding is that the health minister has joined us, is that correct or no?
Hi, yes, I am here.
Good, wonderful.
Okay.
So we have yes, Francesco, please introduce.
Dr. Tafton, yes, very pleased to have you here. Honorable Dr. Chris Tafton, the Minister of Health and Wellness of Jamaica. The floor is yours, please. Accept.
Thank you very much. And good day to you all, depending on where you are in the world, morning or afternoon. I'm pleased to be here and to be able to participate in this forum. And let me first of all bring greetings to Dr. Franco. Sorry, I'm having a little difficulty. Okay. Director of the Department of Nutrition for Health and Development, WHO. Joanna Ralston, CEO of the World Obesity Federation. Dr. Nancy Alberto, Deputy Director of the Food and Nutrition Division, FAO. Professor Joinka Public Health Foundation of India, and Vilma Tyler of Unicef, representatives from the Office of the Global Affairs, U.S. Department of Health and Human Services, distinguished guests, ladies and gentlemen. Again, my apologies for the late entry into the meeting. Firstly, I would like to commend and say thanks to the event planners, WHO, UNICEF, and World Obesity for inviting me to speak at this timely and, of course, significant event. I'm pleased to be engaged in the health talks, which seek to connect debates and policy intervention geared towards tackling obesity with broader discourses on transforming food systems. This is critical because individual strategies cannot solve the problem of obesity, a problem that is broadly systemic and multifaceted in nature. In order to derive the best results from our efforts to tackle obesity, we must transform food system. Indeed, it requires a holistic approach. We have seen unsustainable and unhealthy practices across the food systems, including waste, high cost for and inequitable access to nutritious foods, as well as high usage of fossil fuels and poor labeling practices. We have, as a result, also seen the implications of public health challenges to our efforts to reduce obesity and a global phenomenon, a global challenge. Our food systems, ranging from production, processing to consumption, are too focused, in my opinion, on profitability, which has largely determined what we eat and not necessarily what is best for us. This must change, I believe. We should not allow the industry's unhealthy food practices and their resistance to prevent us from driving an agenda for change, an agenda which seeks to address unhealthy food practices and to tackle obesity using a holistic or whole of system approach. Obesity is not just a problem for wealthier countries. It is also a problem for many small island developing states. In fact, the Caribbean has one of the fastest growing rates of obesity. The prevalence of obesity in adults, as shown in a study conducted by Professor Henry, 2020, quadrupled between 1975 and 2016, moving from 6% to 25%. This means that we must ensure that efforts in the regional, national, and local spaces are also supported in terms of technical and financial support, and also in terms of strong advocacy. Our national statistics are also very telling. Obesity is a risk factor for non-communicable diseases, which causes over 70% of all deaths in Jamaica. Data from the 2016-2017 Jamaica Health and Lifestyle Survey show that 1 in 2 Jamaicans, or 54%, were overweight or obese. Alarmingly,
Minister Tufton.
overweight, obese. Are you hearing me?
Yes, we can hear you now.
Okay, great. Alarmingly, obesity and overweight trends for adults moved from 34% in 2000 to 51% in 2008 and 54% in 2016. The data further reveal that women are more affected by overweight and obesity, with 2/3 of Jamaican women 15 years or older being overweight or obese. The obesity level among high school age cohorts is also a major challenge. The Global School Health Survey 2017 indicated that 65% of children 13 to 17 years were overweight and 26% were considered obese. It also showed that obesity is increasing for boys, moving from 3.5% to 10.3% and from 6.7% to 9.9% for girls. So we have a challenge. We have done a number of things, however, in response. And these initiatives are beginning to bear fruit, but of course it is a process and it requires an all of society approach. So in 2019, for example, the government took the bold step of implementing a policy to restrict certain types of sugary drinks We recognized that we needed a policy and regulatory framework, given that we rank in the top 10 globally for soft drink consumption in adolescents aged 13 to 15 years. And the fact also that approximately 70% of Jamaican children and adults consumed one or more sweetened sugar drink beverage per day. The Heart Foundation of Jamaica and other stakeholders have been integral in this initiative and to the government's efforts to tackle obesity. We have gone further though. The Better For You menu initiative we launched here in Jamaica in May of this year. It was conceptualized as a strategy to help consumers to identify foods sold by quick service restaurants, which are more nutritionally balanced. For any item to be branded as Better For You, it would first require approval from the Ministry of Health and Wellness. And approval means that we are satisfied that the item
Minister Tufton, we lost you again.
Hello, okay, can you hear me now?
Okay, yes, yes, yes.
You're back, yeah.
Okay. Approval means that we are satisfied that the item is more nutritionally balanced than other offerings in a particular restaurant in accordance with the food-based dietary guidelines for Jamaica. We consulted with the participating restaurants to ensure that they understood two things in particular: the importance of giving people healthier options and the broader context in which we are implementing these interventions. It is extremely important, we believe, for the food industry to understand this context of the NCD epidemic and their role in controlling obesity and other NCDs. Indeed, we have said to them, it is good business to promote the health and wellness of your consumers. In the Caribbean, front of package labeling has been undertaken as part of a multifaceted approach to address the increasing burden of obesity. It is a major challenge with significant pushback, but nevertheless an initiative that we're pressing ahead with. The aim is to give consumers important labeling information in a simple and easily understood format to allow them to identify prepackaged foods which are high in critical nutrients, sodium, sugars, fats. The warning label also is used in the Chilean model, which we're seeking to implement to allow consumers to make informed, healthier food choices. In addition, the Ministry of Health and Wellness is moving to establish baseline information on ingredients, sugars, salts, saturated fats, and trans fats in processed foods. We'll use these studies, which we have commissioned, and we have gotten the results on trans fats and saturated fats, so we're now using that. We use these studies to provide greater consumer information to inform food choices. We'll also use the study to guide our policies and regulations. Preliminary findings from a study commissioned by the ministry and conducted by the University of Technology here in Jamaica indicate that some 39% of commonly consumed foods in Jamaica contain trans fats. The study also showed that of the foods which have reference labels for sodium, the majority had greater than the recommended level of sodium for that category or type of food. It is worth noting as well that Jamaica is the first Caribbean country with comprehensive data to join the PAHO initiative to eliminate industrially produced trans fatty acids by 2025. In conclusion, Madam, ladies and gentlemen, our current food systems have undoubtedly failed to ensure that all people in our respective countries, whether high, middle, or low income, have equitable access to healthy and nutritious diets. Current practices are also not driven by sustainability, and that we should ensure that all are aware of as an attempt of changing this trend. Because the problem is systemic, the WHO and other government and civil society organizations are absolutely right to emphasize that what is required is a combination of interconnected actions at the local, national, regional, and global levels. That is to say, we must address the overarching food system instead of individual parts, as well as the broader environment. The Jamaican government has taken bold steps, we believe, towards addressing obesity and towards transforming our food systems. We will continue to call for and develop policies and regulations that ensure that people have active or access to nutritious products and information about what is in their food. We will continue to address obesity in our children by regulating the school environment and advocating for sustainable food practices. We realize that we cannot achieve all of this on our own. Therefore, all stakeholders must be involved in the process of change. As part of the Comprehensive Jamaica recently launched a multi-stakeholder fourth government NCD committee to advise and assist in coordinating the national response to combating NCDs. We will continue to work with various stakeholders at the international, regional, and local level, including intergovernmental, regional, non-governmental organizations. I want to just commit here that I stand ready to advance our collective goal to tackle obesity through a food system approach. Thank you very much.
Thank you very much, Your Excellency, for your very inspiring message. Well, first of all, you've told us about how worrisome the situation and the evolution of obesity is in Jamaica. Remarkable, all age groups so quickly happening, but also you've inspired us by telling how strong the response from your government is, and particularly the package of intervention involving regulatory aspects, the restriction of sugary drinks, the front of the pack, then working to promote a better environment starting from schools. So definitely this is going to be an important example that hopefully other countries will also build on. Clearly, this is an absolute need for a country like Jamaica that together with other small island development states share the same challenges of how to deal with the food system. So thank you very much again, and looking forward to working with you on this important agenda. And now it's really my pleasure to invite the CEO of World Obesity, Joanna Ralston. Over to you.
Thank you, but I just want to say thank you so much to the Minister Tufton. I'm sorry that we didn't get to see your face the whole time, but you gave a wonderful speech. And for anybody who's been privileged enough to hear you in person, as I have, I think the work that you're doing, we all know the work you're doing in Jamaica is extraordinary and just shows what political leadership and a motivated civil society and a fantastic country and community can do together around this. So we really are grateful for everything that you've done and grateful that you're here. And I hope you can stay on for a bit while we go through the rest of our for our panel, which is going to be introduced in a moment. I'm just going to give a little bit of a background first. But again, thank you so much, Your Excellency. It's been lovely to have you, and inspiring to hear how quickly and in such a comprehensive way Jamaica is responding to the obesity challenge. Thank you. So just as Dr. Branca noted, so first of all, thank you, Excellencies, colleagues, friends for being here. It's no accident that we're here on sort of the week after the World Health Assembly closed, but in advance in preparation for the Food System Summit. These are special events that we're doing to really bring to light what is the links between food and health. And in fact, as Secretary General Guterres of the UN said, health is not an afterthought for the Food System Summit, for how food is produced, procured, and consumed. And for us within the global obesity community, it's incredibly important and encouraging that there's recognition of the association between the unhealthiness of large parts of our food supply and the way that contributes to the disease and the risk factor of obesity. On this past Friday, our WHO Director General, Dr. Tedros, noted in his open remarks at the WHO and EAT and Global Alliance for the Future of Food dialogue that obesity is a critical, must be prioritized. We've learned that very much the hard way over the past 18 months or so with COVID, in terms of the increased risk of complications and mortality for people with obesity, of which there's over 800 million adults and children with obesity around the world who we need to be giving much greater prioritization and help to. So food is really food is a major contributor to obesity, although obesity is, as we all know and have said, a complex, multifactorial, multisectoral disease and driver of other diseases. And that's why working with our friends at the World Health Organization and Unicef, we have formed what is now going to be the Global Obesity Coalition. This is very much born organically out of the work that we all do together, the efforts we make to try to coordinate with one another, and in recognition of the urgent need for greater coordination. I think we all see that any multi-sectoral problem requires multi-sectoral solutions, which are by definition complex, not that easy. They're not these single vector challenges. They require different systems to work together. Indeed, one could argue that we are in an era of not just multi-sectoral challenges, but of syndemics, i.e. pandemics that contribute to worsening one another, but for which there can also be solutions together. So the pandemic of obesity, as well as undernutrition, and the pandemic of climate change, for example, all of these elements, and of course COVID, all contributing to one another, all having an effect on one another, and yet potentially also in a positive way, and trying to look ahead, having the potential to build forward. If I could just have a few slides, the next slide, please. I'll tell you a little bit about the coalition. So for World Obesity Day, which was March 4th this year, we worked around the theme of everybody needs everybody, recognizing how universal this challenge is and how much we all have a role to play and a part to play. We look at obesity as a disease of which there are, or a factor of which there are many, many roots. And they include, anything from stigma and unhealthy foods, mental health issues, unhealthy marketing of unhealthy products, access to healthcare, genetic risk, biology. So all these different factors can contribute to obesity, and all in some ways need to be addressed in order to resolve it. We were fortunate at our World Obesity Day event to have Dr. Tedros, Henrietta Fore, who is the executive director of Unicef, and Michael Bloomberg, who is WHO ambassador for NCDs, former mayor of New York, and obviously one of the extraordinarily successful businessman and founder of Bloomberg Philanthropies to state support for this concept. And we are excited now to be talking a bit more about what's next. Next slide, please. So if we look through the timeline since World Health Assembly 74, which was last week, the diabetes resolution, which we're incredibly excited about, and which we really applaud our colleagues at WHO and in the diabetes community for securing, included some very specific and strong language around obesity, recognizing again the association between diabetes and obesity, just as there is associations between obesity and many other diseases and risks. Now we are seeing the G7 come together, the summit pre-meeting, which is taking place in Rome and virtually in July, the UN Food System Summit at the time of the UN General Assembly, which we hope will be in New York with I think virtual elements as well, and of course World Health Assembly 75, which would be next May, where we look forward to building on developing a common obesity roadmap and resolution. Next slide, please. And so the framework for the coalition is that we all share this concern, and this is not limited to the 3 founding members, but to a much wider network of stakeholders in obesity around driving global action on obesity. Our strategic goals are shifting the obesity narrative. I think we know through words, through images, through evidence, there needs to be a much better, more compassionate, more evidence-based, and more productive and effective narrative around obesity. Strengthening regulation where possible. So that is looking at the types of approaches that our colleagues from Jamaica are doing around regulation, food, front of pack labeling, sugar sweetened beverages. And then also recognizing the need for much better ways of addressing obesity in healthcare systems. So these share cross-cutting goals as well around capacity building, facilitating knowledge exchange, and mobilizing resources. Next slide. Next slide, please. So changing the narrative, just quickly, we want to build a public conversation about obesity, better understanding of it, understanding the role that weight stigma plays, mental well-being of children and adults, ensuring overweight and obesity are appropriately integrated into relevant political discussions around health and nutrition. Next slide, please. And that includes images like the one you see there of sort of positive images of people who are living with overweight and obesity. Healthier food environments, which is very much about the regulatory piece, including we will be starting with a particular focus on sugar in foods and work that World Obesity and our friends and members around the world, working with WHO and Unicef and other colleagues, Bloomberg Philanthropies and others, FAO, which is a key partner, promoting use of fiscal measures, advanced front of pack labeling, and scale up procurement, which is an incredibly important area. And we'll hear more about the healthy food environments as well from our colleagues at FAO. Next slide. And then management in primary care, recognizing the importance of addressing obesity in primary care, including healthy diet, which can be part of a clinical encounter as well as other elements. MAPS results, which is research that World Obesity has been doing around health systems in 60 countries to help understand the appropriate intervention points, and seeing where stigma plays a role, because that turns out to have quite an important role as well. Next slide. And then next steps, working on the UN Food System Summit, convening with an initial focus on regulation of sugar in under 5 food and drinks, and participation in Nutrition for Growth Summit as well later this year. So now it's my great pleasure to introduce my panelists, who are the ones who I think have incredibly interesting things, important things to say. So just quickly, we've got from the Food and Agriculture Organization based in Rome, Dr. Nancy Aborto, who is going to share with us some thoughts about the Food System Summit, about obesity and opportunities for integration and change. And then I will introduce our other two panelists. So Nancy, please, if you'd like to just make some brief introductory remarks, that would be great. Thanks.
Thank you, Jana, and good morning, good afternoon, good evening, colleagues, friends. It's great to be here with you today. I wanted just to reflect a minute on what it's going to take for food and health actors to work better together. And I think part of that is really clarifying our comparative or our collaborative advantage. Those are two terminologies that are sort of used interchangeably. But what it's about is recognizing that there are a diversity of actors that can support addressing obesity and supporting what it takes to overcome the global challenge that obesity brings to us. And the way that we do that is in different ways, and however collectively our impact can be greater. Now, Joanna's already mentioned an example of where food and health actors come together, and that's in our work to strengthening those healthy food environments. Of course, this is where we not only physically access food, but we economically access food. And that includes sort of traditional vending, or it also can include other procurement opportunities that can include home support to our own diets, as well as these opportunities for when foods are provided to us, things like in school settings or in institutional settings and in healthcare settings. And you know, we know that nutrition outcomes, including obesity, are really influenced by our choices, and we have agency in that. But that agency is limited by that food environment, or the opportunity for us to practice our agency is related to that environment. So you can see it as an opportunity. And at FAO, we think that this particular engagement point of engagement is an important area for food actors and health actors to come together. And we see a role in supporting governments to establish standards that can foster healthy dietary practices through ensuring that those foods that are nutritious and safe, today is Food Safety Day, are available at an affordable price. And this is an important part of this is with that public food procurement for schools, for public institutions, for healthcare settings as well. So you can really see the diversity of actors that can work together. We also see that support to governments in their abilities and policy initiatives that can incentivize production and retail of more foods such as fruits and vegetables and other foods that are important for for healthy diets. And this again takes a diversity of actors working together. So really that recognizing that diversity and where we can support one another. Now, FAO's vision for nutrition is a world where all people are eating healthy diets from sustainable, inclusive, and resilient agri-food systems. And our mission, therefore, is really to tackle all forms of malnutrition. And this is, if you've engaged with FAO traditionally, there used to be a stronger focus on undernutrition. And what we'd like to say now is that strong focus on undernutrition is still within FAO, but at the same time, we have elevated that focus on all forms of malnutrition, including obesity. And our role is with agriculture and food systems. Our mission then is really tackling all forms of malnutrition by accelerating impactful policies and action across those agriculture and food systems that can indeed enable healthy diets. And through this mission, FAO will continue to contribute to the creation of those healthy food environments, but we'll also continue to be looking for these opportunities like today, where we can collectively come together and talk about where we can support ultimately health outcomes, such as addressing all forms of malnutrition, including obesity. And we look forward to fostering new and stronger relationships.
Great, thank you so much, Nancy. And we will come back with some further questions. But now it's my great honor to have Professor Shifalika Goenka from Public Health Foundation of India. Shifalika, great to see you. We'd like to, if you could just say a few words about your own work, and particularly, I think it would be interesting to hear some of the challenges of managing diet-related NCDs, including obesity in India's primary health system. If you could speak a bit to that and to sort of the concept of a syndemic approach.
Sure. So India, we cannot talk of obesity alone or undernutrition alone, because both of them are bursting. So obesity has doubled in India in the last 10 years, in every state across India, both in urban and rural areas. On the other hand, we have 30 to 50% of our people who are undernourished or stunted. The youngsters, many of them are stunted or anemic. So we are facing the same systems which have given rise to obesity. Undernutrition are giving rise to obesity. And of course, climate change is hitting India very badly because we have a huge coastline. And the reason I'm bringing it up is 70% of India lives in villages, and majority of them survive on agrarian economies, which are rain-fed. So climate change is really hitting. Now, when we're looking at food systems, so as we said, everyone needs to be involved. It's multi-stakeholder. But the fact is that 90% of these rural households, people living in the rural villages, survive on 50 cents a day. So they're extremely price sensitive to what they grow. So we need to have policies by which we incentivize growth of environmentally friendly fresh fruits and vegetables, nuts, legumes, and pulses. And then, of course, look after the supply chain management so that the consumers, and all of them, consumers doesn't mean just people sitting in urban areas, but throughout India are able to access fresh food, fresh fruits and vegetables, nuts, whole grains, pulses, legumes at affordable prices, accessible and affordability. So that's the one key message I'd like to give in the short span. Thank you.
Excellent, thank you. Really, really important points in the world's second most populous country, that it is such a critical and specific system. And now it is my pleasure to introduce Mike Arts from the Latin American and Caribbean offices of Unicef, who will speak to us. Just briefly introduce and speak to how Unicef is really taking a very important leadership role in addressing childhood obesity. Thanks.
Thank you very much, Joanna, and good morning, good afternoon, also to Dr. Branca and to the Excellency Minister Tufton from Jamaica, from the region where I'm sitting, and other panelists, of course, as well. Welcome and a pleasure to be here. Yeah, I think as we've been hearing today, all the systems really need to work together, and we need a holistic approach. And in UNICEF's nutrition strategy, which lasts until, you know, for this decennium, basically, we outline a systems approach that focuses on 5 systems: the food, the health, the water, sanitation, hygiene, the education, and the social protection systems. So for today, I think I'll focus a bit more on the food and health systems, as you know, in line with the topic of this webinar. And with regards to children, what we want from the food system is that it operates in ways that empower children, adolescents, and families to demand nutritious foods, and that we make sure that nutritious foods are safe, available, affordable, and sustainable. And also that we create healthy food environments. And of course, these issues are all linked. And we know that when nutritious foods are affordable and convenient and desirable, children and families can make better choices. Then with regards to the health system, of course, that is the key delivery platform for the prevention and treatment of all forms of malnutrition, including obesity. And it provides multiple contact opportunities with children, adolescents, and their caregivers. So as such, and in the context of overweight and obesity prevention, health systems need to promote nutritious and safe diets and deliver preventive services, preventive nutrition services, and treat you know, on all forms of malnutrition when they arise, and foster positive nutrition practices in households and communities. So from this region, we're very active in both these spaces, and the portfolio also that we coordinate, that I coordinate, includes health and nutrition and HIV, and we work very closely together with our sister UN agencies and other actors. And I can give 3 examples from this region about how we work together, particularly between the food and health systems. For example, in Mexico, we are members of an intersectoral group for health, food, environment, and competitiveness that is called GISAMAC. And where that is an intersectoral group that works on analyzing and contributing to the development of policies for healthy, fair, and sustainable food systems that includes the prevention of overweight. So that is a platform, and that is an example of what we think is actually the best way to bring systems together, that there is a governance body that brings these systems together, from the policies to the service delivery and actions, and including monitoring. So that is an example of that. In Paraguay, we work with the Ministry of Health on the implementation of the national strategy for the prevention and control of obesity in children and adolescents. And that strategy also includes food regulations and guidance for medical staff and health workers on prevention and treatment. So again, a policy level initiative that also includes you know, implementation and monitoring. And lastly, a very concrete example of how food and health systems came together is after specific emergency situations, or like, for example, in Guatemala after the eruption of a volcano, and in Mexico in the context of COVID, where we work together with the ministries of health and the relevant food security bodies on distribution of healthy foods. So promotion of healthy foods and distributing of specific foods for affected families. So again, an example where we bring the policy and the service delivery together, of course, with the local actors that are working on these spaces. Thank you very much for now.
Fantastic, thank you so much. I think unfortunately the minister, I believe, has had to leave, but because I did have some questions. So I'm now going to open this up to questions from the audience. And I know we were, I believe we have a question from a patient, if I'm not mistaken. If not, we'll come back to that. Maybe Rachel could let me know. I've got some fantastic questions, so I actually want to get to them all. There was a question well, first of all, I think this question has come up a couple of times, which is, do the panelists feel that the action tracks of the Food Systems Summit, are they doing enough to address obesity? I think that would be, is there, I'm not going to call on anybody, but more ask, does anybody have a response to that? Or if Dr. Branca does as well. Do you feel that the Food Systems Summit panels are doing enough to address obesity? Francesco, do you want to answer? Because you did.
Yeah, it's a very good question indeed.
Yeah.
Well, the Food Systems Summit works along multiple action tracks, and is certainly highlighting a few areas of convergence of, let's say, win-win for people's health, the sustainability of the planet in an economic, also sustainable way. Obesity as such is one of the multiple forms of malnutrition that the Food System Summit is indeed addressing. But as you probably know, there are many solutions that have been submitted by many constituencies. I think it would be important to highlight the solutions that are going to be particularly impactful on the changing food environment. And, you know, some of them have been actually mentioned by Minister Tufton. But we would like to see the Food System Summit amplifying some of those solutions. So I think the elements are there, but certainly our collective advocacy is needed to give that emphasis so that the coalitions are brought together around those policy solutions and such that really also the advocacy of the Secretary General focuses on them.
Great, thank you. And I think that the general sense is that that it's positive. It certainly is very positive that the dialogue that we had last week was so focused. There was a lot of emphasis on overweight and obesity as recognizing the role, but more certainly could be done. I can say that as civil society, it's easier for me to say it, but that more needs to be done. I think would be the key, but I think as Francesca Branca suggests, there's lots of solutions that are relevant not just to overweight and obesity, but more broadly, which in a way is as it should be. So that's a great point. Interesting question about, it's a very important one for countries with that are not high-income countries, I think. It was a question for Jamaica, but I think I'm going to actually put Shifalika on the spot and ask you to say how you would address this, which is what is the role of treatment methods in the healthcare system? So, for example, the evidence for treatment of obesity is as we know multi-sectoral and multi-faceted, but includes, of course, bariatric surgery and some fantastic anti-obesity medications. How do you see that working in the Indian health system?
It's
redirecting to you.
It's a difficult question to answer, but at present, what I'm seeing around, because we have a very strong private healthcare system, especially when it comes to tertiary care system. So I'm seeing a lot of exploitation of bariatric surgery, which is happening, incorrect and inappropriate exploitation. So personally, I am quite against it because it should be used only in pathological obesity, not responding to any other methods. And I have known firsthand as to how, normally even people who go in for bariatric surgery, they have a lot of psychological treatment and psychosocial interactions which happen structured over a couple of months before they decide to do it. But it's here because of the incentivizing, the privatization. I see a lot of inappropriate push towards that, and I'm definitely not for that. We see very rare pathological obesity here. What we are seeing is more relative obesity. That means even with smaller BMIs, you're seeing more fat, and they don't look obese. So these people. So I would definitely reserve myself for that, and I think the system should prevent the exploitation of bariatric surgery in the Indian context. Definitely.
I think you make a great point that there's a need for quality standards, which that would apply to both private and public. It is true that many countries, and we certainly heard the the average resource in India, although it is a country with great wealth as well, but a lot of non-wealth. It is harder. It's less realistic. I think there are also medications that are becoming available that are very effective. However, there hasn't really been a move towards differentiating pricing, which might happen later on. So I think it's a challenge because there is need for a whole variety of effective treatments, but not necessarily availability yet. But that is also very normal for many NCDs, and something that would definitely be a priority over time, I think, to make sure that the health system offers the best possible availability, including to people with severe obesity. I'm going to pull up another question. We hear that food safety is a remarkable success story, reducing contamination and rates of food poisoning, thanks to strong intervention controls on producers and market regulation. For food nutrition and diet, do we need stronger interventions to improve food quality, or can we assume market mechanisms will be sufficient? I am going to, Nancy, put you on the spot with that one, and then Mike as well, to hear if you have thoughts on that.
Thanks, Joanna. And thanks a lot for the question. I think it's a really good point to go back into history and look at these success stories and what we can learn from them. And I think it's got to be a combination of efforts. We have so many hunger and nutrition problems in the world today that I think that it would be unwise to not consider looking at controls and market regulation as part of a package to support improved nutrition. At the same time, what are market mechanisms that we can also leverage? And again, I think it's gotta come from both directions. And actually, if I may, Joanna, I would like to just add on to what Francesco said about the Food System Summit action tracks, and I think it's also reflected in this question, and though perhaps tangentially. And that's just to say that the entire concept of the Food System Summit is raising visibility about the diversity of impacts that action in the food system can have, and one of those being support to obesity. And I think that is really important because I see that our discussion around how to address malnutrition is still challenged by recognizing the impact that actors outside the health system can have, and having those entry points. And the Food System Summit is really giving us concrete entry points of where we can have these impacts on all forms of malnutrition. So I think that this moment is something we really need to ensure we don't let pass us by when it comes to what we can collectively do to support obesity.
Great, thank you very much for that. So Micah, could you give us a bit of a response on that, and speaking more broadly as well to any tools that Unicef has around assessment of food safety, of food, et cetera?
Yes, thank you very much. I took the question also as sorry, as alluding to or entering into the issue of regulation. And then, of course, an area where Unicef is quite active, and I think actually many of us is sitting around the table, but or the virtual table, is the area of labeling. And in this region, we're working very actively. In the last few years, it was in Brazil, Mexico, Peru, and Uruguay, and before that also in other countries, but on front of pack labeling. Particularly on to mark foods that are high in sugar, sodium, and fat, or high or saturated fat. So that is an area where the health system really is working on and with the food system to make sure that regulations are in place to mark the foods that are high in those unhealthy elements, and or then lead to changes in composition of these foods. And of course, also another area. And in this region, we've recently supported Uruguay and Mexico to look at the monitoring of the International Code of Marketing of breast milk substitutes. So another piece of regulation in the food system where the health system is playing a very active role. So that's areas where we see that regulation is needed to ensure that their children and their caregivers have access to healthy diets. And yeah, so we think that is very important. Actually, Jamaica, I know they're not on the line anymore, but the Caribbean is also very active. I think they're now working, on a very active lobby to get that, to get such labeling across for that whole sub-region. So a lot of work that needs to be done in that area. When it comes to assessing a food system, actually, we've been working together with other colleagues on a tool to assess the retail environment. And I'm happy to share that with you, and we can share it with others, I think, by now, to really systematically look at how unhealthy foods are marketed, particularly towards children, and to go in a very systematic way in retail environments. And it has provided some very useful insights on which foods are marketed, how are they pitching children, and how, which foods are marketed and in which way. So that is a very useful tool that we're happy to share with others. Over.
Great. Thank you. And I think Shifalika Goenka also had a question about this, or would like to respond to this.
Yes, regarding food safety, it's been a success story in the high-income countries, but many low-income countries and middle-income countries, it's not the same. For India, for example, safety is a huge issue for people who are eating out. So I think majority of the time you end up eating unhealthy foods because you're not sure of the healthy options available because of lack of safety, whether it be bacterium in contamination or other aspects of adulteration. And one of the additional barriers which India and other low middle income countries face is the high heat conditions. So the shelf life of food is really indented. We definitely need stronger policy push for safety, as well as we must remember that 80% of our food comes from the unorganized sector. So we have introduced the Chile format of front labeling. And I think they've asked the industries to comply by November. That's what I've heard. So we are hoping, but again, I said 80% comes from the unorganized sector.
Right, okay, the informal sector plays a big role. We had a question from WHO about, or just a comment, I think, from a colleague at WHO about that. There's a recognition of obesity overweight and obesity is less about energy imbalance and more about hormonal imbalance, and the ways in which food additives and processing play a role in the abnormal storage of fat and the consequent health issues. Is there, do we feel that and this is just for anyone who might have a response, do we feel that the efforts of the Food System Summit action tracks are doing enough or are doing anything to sort of recognize that these products are contributing to this challenge? If anybody have any response, or Francesco, did you want to say anything about this?
So I was trying to answer the other question. Meanwhile, can you?
Oh, okay. So please answer the other question as well, and then this one. So, thank you. Please go ahead.
So no, I mean, I think there was a question about the front of the pack labeling, and I was going to say that, yeah, indeed, this is a very interesting solution that is picking up as part of a package, also on marketing restriction and good school food policies in Latin America. That seems to be a very good combination to curb obesity and reduce obesity rates, certainly in children. The evidence there is that it's actually building up. We have different schemes. WHO has published guiding principle on front of the pack labeling. So indeed, the follow-up research is showing that this solution can be at least as useful as maybe even more useful as taxation of sugar sweetened beverages. So definitely something to look into more carefully and to encourage.
Great, thank you. Thanks very much. Okay, so we have time. I really want to make sure that we have that our speakers are allowed to just say one wish, in a way. If you could have one thing from 2021, other than for us to all be vaccinated and the world to be fair again, which is maybe a bigger thing than we can accomplish in this webinar. In terms of just recognizing that this is a year where there's greater focus than there has been before globally on overweight and obesity because in no small part of COVID, but also then because of the Food System Summit and the Nutrition for Growth events, and because we're all, I think, probably slightly more globally aware of how interconnected we are, there's also a greater focus on food. And so if you had one sort of wish for this year, you could say at the end of 2021 is the year we, something, related to overweight and obesity, the disease as well as the risk factor of overweight and obesity and food systems. What might that be? And Francesco, since you were the last to speak, you spoke last, I'm actually going to throw this at you again right now and ask you to respond to that.
Well, I think what we need is scaling up, and we've been all dramatically disappointed by the fact, whatever we say, our decade-long activism on obesity reduction is not, leading us very far. So but we shouldn't give up. We shouldn't give up. We certainly need to look at the early causes and particularly be active in the early nutrition space. We have a lot of successful intervention there. I mean, breastfeeding, we're actually doing better. We need to scale up that. Promotion, protection, and support. We need to also to tackle continued breastfeeding. Remember, the more a child is breastfed, the less she or he are likely to become overweight and obese. So that's a very early part. But we need to be, more active on that early environment for school-age children. If you see the amount of sugar that is present in baby food, I mean, that's awful. And we cannot let it go. We need to take really strong action there. And then, of course, changing the food environment. We've seen about informing consumers at the point of choice through adequate front of the pack labeling, restriction of the marketing, making sure that we use price tools, including taxation, and then adequate food in the school environment. These are all important areas. And then we need to look at the aspect of the management. Obesity management has been completely neglected. And now we're seeing, primary healthcare systems in low and middle income countries that are facing the obesity epidemic were completely not equipped to do that. I mean, health workers do not have the capacity to do that. And even the basics, such as the counseling, is not there. So I think we have clarity about what needs to be done. We need to scale up. And that's what we should do with the coalition.
Great. Thank you. Micah, could you tell us from a UNICEF perspective?
Thank you. Well, if I were to choose one issue, it is actually related to COVID, because we've seen, the pandemic is still very, very real in this region with still very high numbers. And we've seen how much it has impacted on healthy lifestyles over the past year, especially for children, with all the containment measures that were done and not always prioritizing children, not always prioritizing healthy lifestyles. So what we think is very relevant for this region, it is related to reopening of schools, which also, this region has the longest closure of schools due to COVID. So the gradual reopening of schools and access to not just learning, but everything that comes with schools, including healthy foods and education on healthy foods, and of course physical activity, and promote healthy lifestyles and ensure access to affordable and accessible and feasible, healthy foods. We think that is still very important in the context of COVID, and recover, the damage that COVID has done to healthy lifestyles, particularly for children. Thank you.
Fantastic. Thank you so much. Nancy, would you like to say at the end of 2021?
At the end of 2021, and on the heels of the Food System Summit, I would really like to see if we could internalize and really operationalize this idea that healthy diets is an equity issue, that everyone deserves affordable, accessible, healthy diets, and that as a prerequisite for addressing all forms of malnutrition in all contexts around the world. And I think that's really putting that people-center focus on the Food System Summit, and taking what we can leverage from the Food System Summit that really puts that people-centered focus for healthy diets, and amplifying that with the Nutrition for Growth at the end of the year.
Great, thank you. Shifalika.
Okay, so I'm going to quickly put in 2-3 quick things. First of all, safe drinking water. That will prevent obesity in a large number of people. Secondly, the food system entirely, the growth of environmentally friendly fresh fruits and vegetables, and at the consumer level, each and every citizen of India should be able to get healthy, affordable, fresh, healthy foods and fresh fruits and vegetables, nuts, legumes, and pulses. And of course, a built environment which supports physical activity makes it more desirable and acceptable. Over to you. Thank you.
Thank you. I'm going to selfishly grab a moment and say what I'd like to see this year do is maybe end the false dichotomies between prevention versus treatment, or undernutrition versus overnutrition, or climate versus health, and just say this is one planet, one health, and obesity and overweight are given the best possible chance of being addressed and managed within that. So thank you. So now it's my great privilege to just thank all these speakers. I'm just going to clap for you. You were wonderful panelists.
Thank you.
And I really, really appreciate it. It was a dynamic dialogue. I was so thrilled that our health minister was also able to join. And I will say we're getting very positive remarks in the chats. And I will tell you, I don't always get positive remarks in the chats of webinars. It was really, really interesting, important, exciting. And again, I hope we look back at this time and say, wow, we turned a corner there. We really brought all the different pieces together. The coalition is helpful, but so is all the amazing work. I do want to say that I also hope that we have a world of really, truly showing what it means to have people at the center. People with lived experience, people who are consumers, people who are stakeholders with agency. That's a fantastic thing to hope for all of us. So thanks very much. And we will look forward to continue to work with all of you. We are all part of this effort together. Thanks so much. Bye-bye.
Thank you. Thank you.
Bye-bye.
Bye.